Hey guys, Dr. Childs here. Today we're going to be talking about which is more important, free T3 or free T4 if you are a thyroid patient. So in order to do that, we need to really talk about what free thyroid hormones are and really free hormones in general. What do these things mean for you? What are they inside of your body? Why are they so important? So when you check, and this is, by the way, this is particularly important for thyroid patients because most thyroid patients and most doctors who treat thyroid patients, they're not even looking for free thyroid hormone levels. So the chances are very small, unless you're seeing a really good thyroid doctor, that you're even going to have these things checked. So if you are somebody who has not had them checked, then pay close attention to me as I explain to you why they are so important and why you need to be getting both of these. But there will be a clear winner as we go through these things, and it will become obvious as we talk about them. So first of all, what are free thyroid hormones? Now, again, this applies to all hormones in the body because this is really how your body utilizes hormones in general. And that is there are two states. You have hormones which are bound to proteins, which float around in your blood, and you have proteins hormones which are called free, X. So in this case, we're talking about free T3 and free T4, but it could be free testosterone, it could be free estradiol, it could be free progesterone, etc. But for this conversation, we're talking about free T3 and free T4. Now, the difference between these bound hormones and these free hormones is that the free hormones are free and active. You can think of them that way. They are free and active to be used by the body to do the things that you want them to do. So free thyroid hormone means that it can interact with the nucleus in the cell, it can float around your body, it can get inside the cells, it can activate genetic transcription, change the cellular DNA and the proteins that are being produced, and have some sort of end impact on how you are feeling, whether that's helping you burn fat, helping you grow hair, helping you not be constipated, and so on. That's what the free thyroid hormones are doing, which is why they are so important. They should be differentiated from the other type of proteins which are bound to, or the other type of hormones which are bound to proteins, and those are usually referred to as total T3 or total T4 or something like that, or total testosterone or whatever. And that usually includes both the bound and the free. But we really care about the free thyroid hormones, free T3 and free T4 for this discussion. Now, again, there will be a clear winner, but I want to talk about the differences between these two thyroid lab tests and why they are so important. So first of all, free T4, as I mentioned before, is really just the amount or the number of free T4, free thyroid hormone, which has the T4 configuration that your body is able to use and can be activated and turned into T3 as necessary. Now, here are a couple potential downsides to free T4, which you should be aware of when you order this test. So first of all, free T4 is not as powerful as T3. It is not the most powerful thyroid hormone inside of your body, even though it does have some biological activity. So T4 can have some impact on the cell, and it can impact thyroid. It can actually have the effect of thyroid function at the cellular level in some cases, but it's nowhere near as powerful as T3, as we'll talk about in just a second. T4 is also limited because it must be converted to T3 in order to be active, and that occurs through this process called thyroid conversion. So when you check your free T4 level, it's good to know that there's that much T4 floating around, but really what it doesn't tell you is that how much of that is being activated and used by the body, because in order to be used and activated, it must be converted from T4 to T3. But you can use the free T4 level as a way to determine the reservoir of how much potential T3 that you have. So if your T4 level is very high, you can kind of think of it as like water behind a dam. So there's lots of water behind the dam, which means that potentially you can get that water out. And in this case, beyond the dam, we're talking about T3. So if there's a high level of T4, there's a lot of potential there to turn into something that's really good, in this case T3, but it doesn't guarantee that that process will occur, because in order for it to happen, you must undergo T4 to T3 conversion. Another important thing to know is that there's much more free T4 in the body compared to free T3, and it's for the reasons that we mentioned previously. Your body knows that it can draw upon that free T4 reservoir to produce T3 as it needs and on demand. So your body would rather have more free T4 compared to free T3 for that reason. So if it says, let's say that you're thinking really hard one day or studying for a test, your body may know that your brain requires more activity compared to, let's say, the muscles in your legs, because you're just sitting there all day. So your body can actually compensate for that, and it can determine which tissues need more T3 and which need less T4 and so on, or which need less T3 and so on, by using that reservoir system. Now, another important point is that T4 is found inside of medications like levothyroxine and Synthroid. So if you are taking a medication like levothyroxine and Synthroid, you will see an increase in your free T4 levels, or at least you should, provided that you are absorbing it. So that's free T4, and that's why it's so important. Now let's talk about free T3, and the comparison will kind of become obvious as we go through here. So free T3 represents the amount of free thyroid hormone, free T3, that is active to be used by your body. And this is much more beneficial than T4 because it is approximately 200 to 300 times more biologically active compared to free T4 levels. So what that means is if you have the same amount of free T4 and free T3, that free T3 can do 200 times the job or 300 times the job that the same amount of T4 can do, right? So it's vastly superior in terms of how effective it is in the body. So little doses of free T3 or getting your free T3 up even just a little bit will have a more profound effect on how you are feeling compared to getting free T4 up at the same level. In addition, free T3 doesn't need to be converted or activated to be used by the body. It comes completely active and used by the body. Having said that, it may be limited in its ability to function by reverse T3 and some deiodinase enzymes. So there are things that can happen inside of your body that can increase reverse T3 levels, and the process by which these levels are increased can limit how effective free T3 is by blocking its function at the cellular level. Now, we don't really have a similar thing that occurs with T4, but you should be aware that T3, even though it is very valuable, it must also be, the levels of reverse T3 and free T3 actually matter for that reason inside of the cell. There's also much less free T3 found inside the body compared to T4. It's produced a lot less from the thyroid gland, for instance. About 80% of all thyroid hormone produced by the thyroid gland is T4, and about 20% is T3. And then the bulk of the amount of T3 that your body uses is converted in peripheral tissues, including the liver, your gut, and then individual cells as they need it as well. You can also find T3 in thyroid medications, including natural desiccated thyroid, which is a combination of T4 and T3. You can find it by itself in medications like Cytomel or liothyronine, and even sustained release T3. And it can be added to compounded thyroid medications, such as T4, T3 compounded thyroid medications. And if you take free T3, you will see changes in your thyroid lab, in your free T3 level. So if you're taking a medication which contains free T3, that will be reflected inside of your labs. So which is more important? Free T3 by far. In fact, free T3 is probably one of the better, maybe not the best, because you really want to get multiple thyroid lab tests so you can see what's going on. But if it was between free T4 and free T3, I would highly recommend that you get the free T3 level because of the reasons that I mentioned previously. It tends to be one of the only, or at least the best thyroid lab test which tracks with how you are feeling. So in other words, as free T3 levels drop, you're going to feel worse, and as free T3 levels increase, you're going to feel better. That is not always true with free T4. That it could be the case that high free T4 levels can make you feel better, and low free T4 levels may have no impact on how you are feeling, because that free T3 can take up the job of whatever free T4 cannot do. And so if your free T3 level is high but your free T4 level is low, you can still feel good because it tracks better compared to free T3 and also, or free T4 and also TSH. In addition, free T3 is a little bit better, I think, because you can see changes in the blood serum with relatively rapidly compared to T4 levels. So T4 stays in your body a lot longer, whereas T3 is in your body and bloodstream a much shorter period of time, which means that you can tweak and adjust your dose as necessary. In addition, low levels of free T3 tend to be associated with more severe thyroid symptoms, including things like weight gain, depression, and also joint and muscle pain as well. It's, the type of thing that can mimic fibromyalgia-like symptoms. So if it comes down to it, remember, free T3 is incredibly important, more important than, let's say, free T4, and more important than the TSH, but it is a good idea to get all of these things together so you can see patterns, you can see how things are changing, and you can determine, are you actually taking that free T4, turning it into free T3, what's happening inside of your brain, how your brain is communicating to your thyroid, and so on. So it is the case that free T3 is a better test. However, it should be used with all of these things for the reasons I mentioned previously. So that's all I have on this topic. If you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information all designed to help thyroid patients like you feel better. And I would recommend that if you haven't, that you check those out because there's tons of information in there. That's all I have for you guys today on this topic. And otherwise, I will see you on the next one.